Good afternoon, everyone. My name is Rasan Holly. I'll be conducting today's webinar. We'll get started in 1 minute. I'll just give it a few more minutes to let folks join on, and we'll start promptly at noon. All right, guys. I think we'll get started. Thanks for joining. I really appreciate you guys and everyone spending their Friday afternoon listening to the webinar today. Allow me to introduce myself. My name is Rasan Holly. I'm an occupational therapist at the MedStar National Rehab Hospital in Washington, D.C. And I'll be conducting today's webinar discussing some of the Saebo products and how you can incorporate it into your treatment to help facilitate or encourage arm recovery after stroke or brain injury, as well as lower extremity return as well. Just a few housekeeping issues. We're going to save all questions to the end of the webinar. And if you like, you could type your questions in the display box, and at the end we'll have about 5 minutes to 10 minutes where we'll discuss and we can try to answer some of the questions that you posed. So if you do have questions, please write them down and put them into the chat box, and myself and our panelists from Saebo will answer any questions that you might have. So let's get started. Saebo is a neuro rehab company that started about in 2001, basically looking for some rehabilitation options for individuals who had particular some shoulder movement and elbow movement after a stroke, but they lacked the ability to include the hand in functional tasks. So they were really interested in providing some type of treatment option for individuals who had some return in the arm after some neurological injury, but they didn't have full functioning of the hand. So at the time, they developed a device that a stroke survivor or a patient could wear on the hand to help with training the hand on functional use and incorporating the hand into functional activities. It was called the SaeboFlex, and we'll discuss it in a second here. So they developed the SaeboFlex back in 2001, and that's when I received my exposure to the device. So I'm as I mentioned earlier, occupational therapist, and I spent most of my career here at the National Rehabilitation Hospital. I've been treating an inpatient rehab, so immediately after an individual would suffer a stroke or a brain injury. I've worked in the outpatient setting. I work in the home care environment. I participate in research. So I have really a lot of exposure to seeing the full course of an individual post-injury. And I got my exposure to Saebo was during the inpatient rehab, so immediately after a stroke or a brain or a neurological injury. And what I used and what I was trained on with during those inpatient years was on the SaeboFlex. And as we'll see in a sec, it's a real innovative device that helps encourage hand recovery after stroke. And you could actually put the hand in a functional position that allows the hand to engage in functional activities. So that was Saebo's first device, and it's probably one of its most popular products that they sell. But since then, so fast forward 17 years, Saebo is now offering many different products for the neuro patient who has limitations in upper extremity as well as leg movement. And the goal of the webinar today is to just give you a taste of a lot of products that Saebo offers and how you can incorporate it into your home exercise program or your therapy session, and when certain products are appropriate and when certain products aren't appropriate. This is really just a general overview of the products. I highly encourage you, after you hear today's webinar, there will be a representative from Saebo who will follow up with you. If you are able to get your hand on some of the products just to play around and get some exposure to the devices, that will really help complement the knowledge or the information that I'll be sharing today. So it's one thing to listen on a webinar, it's another thing to actually get your hands on some of the products and see how they actually work in real life. Again, someone from Saebo will be following up with you after today's webinar, and if you can ask for a demo of some of the devices and products that we'll discuss, they'll be more than happy to discuss with you how to do that, okay? So with the introduction and giving you a little background of Saebo and my exposure to the Saebo products, let's discuss some of the products that they offer. Just real quickly, this slide just gives you a general picture of all the products that Saebo offers, and we'll just go a little bit more in depth as the webinar goes on. But the device here, this picture here, this is of the SaeboFlex. So this is the device I was discussing earlier. So it's a functional dynamic orthoses that puts the hand or the affected hand in a functional position to allow to engage the patient in more home-based and therapy-based activities. There's another elbow component to it, which is called, that allows the individual to extend their elbow, and it facilitates not only elbow extension, but also finger extension. And when you combine the above elbow component with the distal component, the entire device is called the SaeboReach. And we'll discuss that in a second as well. This product here, the next product down, is called the SaeboStretch. So it's a dynamic hand splint designed to prevent joint damage in the fingers if tone kicks in. So it keeps the fingers and the joints of the hand in the proper position once the tone kicks in and the fingers want to curl, and it helps put the fingers back in the proper position so it avoids joint deformity. We have the SaeboMAS, which is here, which is a zero-gravity mobile arm support system designed to help clients with a weakened shoulder and allows the patient to engage in more activities without the weak shoulder and allows them more mass repetition, task-oriented treatment. Then if we look at some of the electrical stimulation devices, we have the Saebo Aviva Stim. It's a two-channel electrical stimulation device that has 13 different programs. So it's a unique, simple eSTEM device that you could provide if you're a therapist to your clients, or if you're a patient, you can use at home. A little bit more involved is the SaeboMAS Trac Infiniti, which is a biofeedback triggered electrical stimulation device. Okay, and the reason why it's biofeedback, because the patient would receive visual and auditory cues on how much they're contracting or attempting to activate a muscle. And once they reach a certain threshold that the therapist sets, a stimulation is provided. So it's more driven by the patient, and it's more involved active patient as opposed to more of your passive eSTEM devices. We have the SaeboReJoyce, which is an upper extremity virtual reality system, where the patient would engage in different movements of the arm while they're playing different games that are displayed on the computer screen. We have the Saebo gross motor equipment, as well as the SaeboGlove, which is a device for those patients with an orthopedic or neurological condition where they have some finger extension, but they need assistance with composite finger extension. So it allows the patient to involve the hand in more functional and therapeutic activities. Devices that aren't pictured here are some of our newer devices that we'll discuss, such as the Saebo VR, which is a virtual reality system, as well as the SaeboStep, which is our first entry into the lower extremity market as well as the SaeboStim Micro, which is the subsensory electrical stimulation to the arm and the hand. So what are the goals of Saebo? Basically to allow patients to use their arms more functionally, decrease non-use, increase learned use, reduce spasticity, improve range of motion, strength and control, improve occupational performance, and of course, improve quality of life. So jumping right in, if we talk about the different products, we're looking at the SaeboFlex. So the SaeboFlex, like I mentioned earlier, was Saebo's first device, okay? So it's a dynamic, custom fabricated wrist, hand, finger orthosis that features a spring-loaded finger and thumb extension system. The extensor spring system assists with reopening the fingers after functional grasp. So who's appropriate for the Flex? So pretty much any individual unable to use their hand functionally, or they cannot extend their hands due to tone of the wrist and finger flexors. So if there's a lot of tone in the wrist and finger flexors, the patient lacks that ability to fully extend the fingers. So why was the SaeboFlex developed? I alluded to this a little bit earlier, but at the time when the SaeboFlex was designed by the creators of Saebo, at the time there weren't that many treatment options for individuals who had some shoulder, some elbow, but they lacked hand movement. So the only real effective treatment at the time was constraint-induced movement therapy. So there was a need for something different, something a little bit more intense to help include the hand in functional training. So here's a video of how it works. So pretty much the patient activates the long finger flexors, so the flexor digitorum superficialis. So the movement's coming from this joint, your PIP joint in the fingers, and then your MP joint in the thumb. So that's your flexor pollicis spreadus, is a particular muscle. And what we're doing is we're having the patient contract that muscle and then focus on relaxing the muscle to allow the fingers to extend. So you're retraining the hand or the flexor muscles to activate and then relax to allow the spring to extend the fingers into extension, okay? So it's really meant to retrain the patient on how to activate a muscle and then relax it to allow the extensors to open up. So this slide here pretty much describes what I just mentioned. So the patient would grab an object using their volitional flexor control. So the muscles of the wrist and the fingers to pick up an object. They carry the object to a desired location, and then they relax the flexor tone to allow the extensor spring to open up the fingers and the thumb. Okay, so who's the candidate? So any patient with limited shoulder and elbow movement and limited wrist and finger extension. So specifically, 15 degrees of shoulder elevation. So that's 15 degrees of movement anywhere in the shoulder. So just movement anywhere at the shoulder. 15 degrees of elbow flexion or bending the elbow up to about 15 degrees and a quarter range of finger flexion. So we like to call it 15, 15 and a quarter. So 15 degrees at the shoulder, moving the shoulder in any direction, 15 degrees at the elbow, and a quarter range of finger flexion. So here's a few slides of what a particular patient would look like. So if the patient tries to pick up the cup here, he lacks the finger extension, wrist extension to get his hand around the cup. Okay. We then put him into the SaeboFlex. And he can activate the finger flexors, pick up the cup, and complete the task. Okay, we have a spoon. All right, he's able to scoop with the spoon, as well as if we put his hand into the SaeboFlex, he's able to scoop it, no problem. So we can see she's trying to pick up the ball, and she lacks that finger extension to get her hand around the ball. Okay. We then put her into the SaeboFlex, and we can see she's able to pick up the ball, no problem, and drop it over. Okay, so pretty much the SaeboFlex puts the hand in that functional position to grab the ball or the object and then to release it. So if we look at a particular case study, so this is a patient, acute stroke survivor, 3 weeks post-stroke. He came in to see us 3 times per week for 12 visits. Each session lasted 45 minutes, and we recommended a home exercise program for 40 minutes per day. So the task that we had him do was using the SaeboFlex and some of the gross motor equipment that you'll see in a sec. So looking at the baseline movement, so what we wanted was, again, quarter or 15 degrees at the shoulder, okay? And he's able to get about maybe 15 degrees of shoulder abduction. So he definitely meets the criteria at the shoulder. We then want 15 degrees of elbow flexion, okay? And he's able to get about 90 degrees of elbow flexion. So he definitely meets the criteria at the shoulder and at the elbow. We then stand him up, and we want to see if we have a quarter range of finger flexion, and we get about that quarter range of finger flexion. So he's definitely a candidate for the SaeboFlex. So this is his first attempt with the SaeboFlex, visit 2. He's able to grasp and then relax the flexors to release the ball into the crate. So he picks up, he's able to pick up the object and relax it and drops the ball into the crate. We then move over to another activity, the 5-ball peg activity, where he's able to pick up the peg, but he lacks the strength to put the peg into the target. So he doesn't have enough strength to complete the task, but he does have enough strength to lift up the object and carry it over. So now fast forward, visit 10, and here he is doing that same 5-ball peg activity, but now he's able to release the object into the target. You can see also that the therapist made the task a little bit harder by moving the target onto the other side, so requiring a little bit more trunk rotation, as well as requiring the patient to bear weight on his weaker leg. Okay, this is visit 12 without the SaeboFlex, and you can see now his hand is nice and loose. He's able to pick up the object, carry it over, not dealing with that flexor tone that he was dealing with before in the hand. 5 months post, here he is using the left hand to sort change off of the table. Okay, working on dexterity type of task. The next video, here he's setting up his E-stim unit. So you probably noticed that he lacks a little bit of the wrist extension, so bringing the wrist up. So here he's using the left hand as to engage in more bilateral activities, so setting up his E-stim unit. And then in the video on the bottom, he is sorting change out of his hand. Okay, so not saying that every patient is going to see the same returns, but this is just gives you a general idea of how you could incorporate the SaeboFlex into treatment. Now the SaeboReach, as I mentioned before, this is a dynamic custom fabricated elbow, wrist, hand finger orthosis. So this includes that above elbow component, which is this here, and combined with the SaeboFlex, which is the distal component. And the above elbow component is connected to the distal component, the SaeboFlex, via these tension bungee cords. So basically what would work, it works the same way that the SaeboFlex works. So the patient would activate the bicep and then focus on relaxing the bicep to allow the bungee cord to extend the elbow. Okay? So again, the patient activates the bicep, relaxes the bicep to allow the bungee cord or this extension system to extend the elbow. So this slide just reiterates that. So the reach consists of the SaeboFlex, which is here, and the custom fabricated above elbow component. The main feature of the Reach is the elbow extension system. And the extension system helps with straightening the elbow after functional reaching. So the best way to show the SaeboReach is to show it in action. So here's another case study. This is a patient who was in a stroke survivor, subacute phase, so just immediately after his stroke. He came in to see the folks at Saebo 3 times per week for 9 visits. Each session lasted 45 minutes, and a home exercise program we recommended was 2 45-minute exercise programs per day. The treatment was repetitive, task-oriented training, this time using the SaeboReach and some of the gross motor equipment. Okay, so here is the patient trying to pick up the ball, and again, you can see he lacks that volitional finger extension just due to that increased flexor tone. All right, so then we put him into the SaeboFlex, and you can see his hand is in a better position. He could come down around the ball, pick up the ball, carry it over to the crate again, so he's activating the flexors, relaxing the flexors to drop the ball into the crate. Okay, and then he's able to continue to engage in the task with the hand in that functional position. So really addressing the flexor tone in the wrist and hand. Okay, visit 8, we then put it on the above elbow component, and you can see the tensioners, after he picks up the ball, he has to push it through this hoop and drop it into the crate. Once he picks it up, he reaches over, extends, and then drops the ball into the crate. You can imagine if we didn't have the bungee cords, he would be more in elbow flexion. So in order to complete the task, he would have to compensate. So trunk flexion to get his hands through the hoop here. So here, by adding the above elbow component, you're decreasing any trunk compensations or body compensations that might emanate. Now, this is without the SaeboReach. So you can see his hand is nice and relaxed. He gets really nice finger extension to get his hand around the ball, and he's engaging in the task a lot easier. Okay, 6 months later. So here he is doing some timing drills, so bouncing a ball off a trampoline and catching. Okay, again, this is not every patient that we see is not going to see these type of returns, but it just gives you a general idea of the type of results that we could potentially see if you engage the patient with the appropriate activity as well as the appropriate tools. Moving on, along the same principles as both the SaeboFlex and the SaeboReach is the SaeboGlove. So this is one of Saebo's newer devices. And what it is, it's a cutting-edge, low-profile glove that is appropriate for both the neuro patient as well as the orthopedic patient. And it's really ideal for those patients who have some finger extension, but they lack composite or full finger extension. So with it, it allows the patient to engage in functional grasp and release or task training or task activities at home or in the gym. So how does it work? Pretty much the same way as you see here. So the patient activates the flexors and then tries to relax. And with the SaeboFlex, we had the spring helped with opening the fingers. But as you can see with the SaeboGlove, you have these tensioners or rubber bands that are connected to this dorsal base splint to the glove via these little the hooks that are on the individual joints of the fingers. So the patient activates the flexors, tries to extend, they can't get full extension, then the device would move them into full extension. Why use the SaeboGlove? Basically to help patients include or incorporate the hand more functionally in home and in therapy, increase motor control, strength, range of motion, increase function with and without the glove, allow patients to engage in functional activities immediately. So if they don't have the finger extension, it allows patients to engage in functional activities immediately and not have an excuse of not engaging in tasks because you lack full finger extension. And you could combine it with electrical stimulation devices as well. So who's appropriate for the SaeboGlove? Stroke survivors, individuals with brain injury, spinal cord injury, MS, Guillain-Barré, other neuro conditions, radial palsy, brachial plexus, and any individuals with limited wrist and finger extension. But the major issue is the patients must have low tone. So you can imagine if they have severe tone, or it's real difficult to extend the wrist or extend the fingers, they might be more appropriate for the SaeboFlex or the SaeboFlex or SaeboReach, because this device is really ideal for those patients who have some finger extension, but they need some assistance to get full composite finger extension. So some video examples. So here's an individual with radial nerve palsy without the glove. Here he's trying to move the cup from one side of the table to another, but he lacks that finger extension to be able to do it. So we then put him into the glove, and he's able to do the task pretty easily. Here's the same patient trying to open up the cabinet without the glove. Then if we include the glove, he's able to open it no problem. Here's a spinal cord patient without the glove, has some finger extension, but not full. And then we have him try the dowel Velcro activity, and you can see he's having difficulties moving the dowel down the board. We then put him into the glove, and you can see we get more of a full composite finger extension as opposed to before. And then if we try the Velcro dowel task, he's able to perform it a lot easier. Here's a stroke survivor. Has some finger extension, okay? Or say he has finger flexion and then some volitional finger extension. We put him in the glove. He's able to get more of that finger extension that we're looking for. And then with that, then we can do grasp and release and engage in more of a functional activity, including the hand. Now, just moving and discussing another device that Saebo offers is called the SaeboStretch. So this is a resting hand splint that's unlike other splints out there. So typically with the other static splints on the market, once a patient activates their moves or try to move their arm or walks or sneezes or laughs, tone usually increases in the hand. And with your traditional static splints, once that happens, the fingers curl in the splint, basically resulting in a lot of joint deformity, as you see here. Okay, so what's really unique with the SaeboStretch is a dynamic resting hand splint, meaning once tone kicks in, the patient walks, they stand up, they sneeze, they laugh, the device actually bends with them. So as you can see here, the fingers are straight, tone kicks in, you have a bending action. So the splint actually can accommodate their tone. When the tone subsides or the patient relaxes, the splint actually recoils back and properly positions the fingers back into the proper position. Okay, so it bends, then they relax, and then the splint positions the fingers back into the normal position. Unlike your static splints, once the fingers bend, they don't get that recoil action back. They're just curled up in the splint, which causes major joint deformity. So here's just a slide that describes what about the splint. It's a revolutionary dynamic handpiece that could really address the different tonal changes that a patient might go through in a typical day. The reason why it bends, you have interchangeable resistive hand plates that the therapist or the patient can change depending on the tone in the hand. What's really unique about the splint as well, it has elastic non-slip straps that are sewn to the actual splint, as you can see here. It has zippered, removable, so the cover is actually zippered, so you can unzip it and wash it with normal cleaning methods. You have a raised padding for the palm of the hand. You have an adjustable thumb as well, so depending on the patient's thumb position. And you have stabilizing wings for the forearm as well, so the splint doesn't move on the patient's hand. Okay. These are just pictures of the interchangeable hand pieces that come with the splint. So you can see here you have a yellow, which is the lightest hand resistance plate, and then the blue, which is the strongest resistance plate. The device is actually shipped to the patient with a red, which is the medium resistance. So depending on the patient's tone and what their needs, you would, or the therapist or the patient would change out the actual hand plate to depending on the patient's need and the best plate to provide the most amount of assistance to move back into extension once the fingers curl. Another device that Saebo offers is called the SaeboStem Micro. Okay, the SaeboStem Micro provides a low sensory electrical stimulation to the arm and hand, utilizing the specialized electro garment that's on the glove and at the elbow. This unique electro garment is comfortable, it's easy to wear, and you can actually use it during activities as well. Inside the garment, it's made of nylon fibers or Decron that has silver threads in them. And the silver threads, it helps with conducting the electrical charge or the electrical stimulation from this unit to both the elbow and at the hand. Why use the SaeboStem Micro? So as the research shows, as you can see here, individuals after with hemiparesis, after some type of neurological injury, they're not using their effective arm as frequently as they should. So some studies show that individuals only use their effective upper extremity for only 3 hours per day. Other studies show that the effective arm is used only 30 minutes during a 9-hour day. So research shows if we want to have our best chance for functional recovery of the upper extremity, we really need to engage in repetitive tasks. It needs to be used repeatedly, throughout the day. It can't just be used 3 hours a day. And by doing that and by encouraging more use, we have the better chance of prolonged and sustained recovery. So we need different ways of trying to stimulate the affected side. So the SaeboStem Micro shows is basically providing a subsensory, so undetectable to the patient, stimulation to the affected limb. And research shows that sensory electrical stimulation can be an effective treatment for improving not only sensory recovery, but also motor function as well. The main goal of the SaeboStem Micro is to maximize input by providing stimulation at very low levels without producing a muscle contraction. So we're providing stim without producing a muscle contraction, just to stimulate at the sensory level. Studies show that providing that sensory level stimulation to an impaired nervous system can help prime the motor cortex to be more susceptible for neuroplasticity, which then would help with motor recovery. So pretty much with the subsensory stimulation, you're priming the motor cortex to help with neuroplasticity, which then would help with motor return. The recommended protocol, typically during the day you can exercise or do at home or in therapy 2 times per day for 30 minutes is really ideal. Clients with some hand function are encouraged to combine it with combined sensory e-stim with hand training, so typical therapy exercises. You can wear it at night as well, but it's not mandatory. And benefits: decreased spasticity, improved motor function, increased sensation, improve inattention or neglect. So definitely if the patient has inattention or is neglecting one side, it's a great way to stimulate that side of the body. It may potentially help with decreased swelling, pain, and potentially normalize hand temperature. Now, something that Saebo for the therapy clinics out there, something that's new that Saebo is offering is a Saebo hand treatment kit. So basically what it is designed for is for hospitals and clinics, and it's an all-in-one kit that addresses all the upper extremity motor return needs for the patient. So it includes a SaeboGlove, a SaeboFlex, a SaeboStretch, SaeboStem Micro, and the SaeboStep. So if the patient would need electrical stimulation, there's a product for that. If the patient has some volitional finger extension, but they need a more complete or composite finger extension, you have the SaeboGlove. If someone has a little bit more tone, you have the SaeboFlex. You have the SaeboStretch for proper finger positioning. So it would all come in one kit. So this is something that's really unique, that's new, that Saebo's offering. So I definitely recommend when you have the Saebo representative who will contact you after the seminar, that you ask them about the Saebo hand treatment kit. One of Saebo's newer devices that they came out with is first device for the lower extremity. So it's called the SaeboStep. It consists of a lightweight, uniquely designed foot drop brace, which is here, that provides convenience while performing optimal foot clearance and support during walking. The SaeboStep is designed to replace those uncomfortable AFOs that are out there that a lot of stroke survivors use. And what it does, what's really unique, you have this ankle brace, okay, and it's connected to hooks that are in the shoe, okay? And the hooks are connected to the brace via this spectra cord or a cord design. And what you would do, you have the brace on at the ankle, you attach the cord to the hooks that are in the shoe, and then you adjust via the BOA dial technology or a BOA dial the tension that's on the cord. And basically, the more assistance the patient needs in dorsiflexion, you would tighten up the dial. And basically, it helps the patient with swing during the gait. And then when the patient's finished, you just pull the dial out, and it would release the tension to allow you to take the device off. Here's the general makeup of the device. Okay, it's really unique. I have a lot of PT colleagues who use it, and it's a really good way of helping with the swing phase in the ankle and really addressing that dorsiflexion in patients who lack it. And it's more comfortable for patients as well because they don't have the bulky AFO that they need to use. Who's appropriate for the SaeboStep? So neuro patients, so your stroke, MS, spinal cord injury, Parkinson's, ortho patients as well. Okay, the only contradictions if the patient has high tone, they probably wouldn't be a candidate because you probably couldn't put that much tension onto the device to cause that dorsiflexion at the ankle. And clients with only one-handed function will require a caregiver for putting it on. Okay, these are the type of shoes that you can use it on. And then also, if you have shoes that don't have shoelaces or don't have the holes for the shoelaces, there's a tool that Saebo could provide that actually could make holes in the shoes that you can attach the Velcro to. The hook to. So there's an option even for those shoeless shoes out there, or the laceless shoes out there. Excuse me. Another device that Saebo offers. This is more for the clinic, but it's called the SaeboMAS. And the SaeboMAS is a dynamic mobile arm support system. So mobile arm support systems have been out in rehab or in the rehabilitation field for years, all the way back in the 1950s. But one of the most common complaints about the older type or old traditional forms of mobile arm support systems were that they're uncomfortable, they're difficult to attach to wheelchairs, they're cumbersome, they're hard to incorporate in functional activities, and they weren't used as often. So Saebo heard of the need for a newer device that can help with the weakened arm and would be appropriate for individuals who need to really address the weakened upper extremity and would benefit from a mobile arm support system. And they came out with a device called the SaeboMAS. So the SaeboMAS is a zero-gravity dynamic mobile arm support system specifically designed for the individuals with a challenged shoulder to really engage the patient in high repetition activities. So the MAS is pretty much made up of a spring-loaded parallelogram, which is here, okay? And a therapist would tighten or increase the assistance or increase the tension on the spring depending on the patient's weakness. So as the patient needs more assistance, let's say it's difficult for them to move their arm from at the shoulder, the therapist would adjust the tension on the spring to allow the spring to take more of the weight of the arm. But as the patient improves the strength and they get stronger, you would decrease the spring and allow the patient to engage more on their own. Okay, so the least amount of tension is set at a 1. Most amount of tension is at a 15. So a couple of case examples. So here's a stroke survivor using the SaeboFlex, and we're trying to have him move it to the yellow tube. He's able to do it, but he has a real hard time putting his hand into the tube and also getting it out of the tube. Then we then had him continue the task with the SaeboMAS, and you can see he's able to do it a little bit easier. So similar situation, have a patient using the SaeboFlex, trying to move their arm into the crate. We then put them into the SaeboMAS, and you can see she's able to move the arm a little bit easier and to complete the task. And then this last video here, this is a patient using the Flex, going up a little bit higher to the red tube, so requiring a little bit more assistance to lift up the arm into the red tube. We put him into the MAS, and he's able to lift up the arm, drop it into the yellow tube, and then lift the arm out of the tube and complete the task. Here's a spinal cord patient using the same test, more for proximal strengthening. Okay, so targeting type of exercises. Okay. You can also use it for functional activities. So at our facility, we have a few of them in our clinics. We use them for our feeding groups on inpatient rehab, for our ADL or cooking activities. If patients need assistance, they have a weak shoulder and they need to engage in more functional tasks, they use it for ADLs or cooking activities. So you can use it for functional activities as well. It does come with a base if you need to, if you want to roll it around the gym or use it in your dining clinic or dining room, or you can move it to your ADL kitchen. So you do have casters that Saebo sells with it as well. Now, for the pediatric population or home care or maybe outpatient gym if need be, Saebo made the SaeboMAS Mini, which is a smaller version of the SaeboMAS. This is a quick video of what the MAS Mini would do. And pretty much is the same idea. It provides that proximal support that allows the patient to engage in mass repetition. But the only difference with the MAS Mini, as you can see, obviously is smaller. It doesn't provide as much assistance, so the weight capacity is a little bit less than the MAS, but it's really ideal for those home care patients or pediatric patients that you might see. So here's another video example of a patient using the SaeboMAS Mini. He's trying to pick up the ball, put it into the yellow tube. You can see he lacks that proximal strength so much he has to use his other hand to lift up the ball and drop it into the tube. We then put him into the SaeboMAS Mini, and you can see he's able to do the task a little bit easier. And he's able to engage in more mass repetition as opposed to before where he couldn't lift up the arm. So prior, if we didn't have the SaeboMAS Mini or the MAS for that matter, it would be the therapist trying to facilitate or do a hand-over-hand technique to complete the activity. So when we compare the two devices, the MAS is 11 pounds compared to 7.5 pounds for the SaeboMAS Mini. The MAS is 46 inches long compared to 29.5 inches long in the Mini. MAS is 41 inches high compared to 21 inches high for the Mini. And as I mentioned before, the weight capacity for the MAS is 15 pounds as opposed to the max capacity, weight capacity for the SaeboMAS Mini is 8.5 pounds. Looking at some of the electrical stimulation devices, so we have the SaeboMAS Trac Infiniti. So this is an advanced biofeedback electrical stimulation unit. So it's unique because it offers EMG biofeedback, electrical stimulation, EMG-triggered electrical stimulation, and reciprocal EMG-triggered stimulation. And we'll go into each in a sec. Pretty much EMG is a two-channel high-resolution surface electromyography. So basically, electrodes go over a muscle, and it can detect how much a particular muscle is activating. So when you have EMG, you can use it as a biofeedback technique where the patient can get visual cues and auditory cues on how much a particular muscle is contracting and relaxing. What's unique about the Trac Infiniti, it also features electrical stimulation. So those electrodes can also serve to provide electrical stimulation. Also is an EMG-controlled electrical stimulation, which would be the therapist would set a threshold that the patient would need to contract the muscle. Once they contract the muscle at that certain threshold, the patient is rewarded with electrical stimulation. So unlike other electrical stimulations where it's more passive, the patient doesn't need to do as much. With this device, the patient needs to activate the muscle first to get the stimulation, okay? And that's really unique and unlike any device that's on the market right now. The benefits of stimulation helps with muscle re-education, muscle pump contraction, and increased local blood circulation, helps address muscle atrophy, helps with strengthening muscles, maintain and increase range of motion, addresses spasticity, and works on acute and chronic pain control. So here, this slide here just reiterates what I said before. So EMG trigger stimulation. This is when you put the electrode on the muscle to detect muscle activity. Once the patient volitionally contracts the muscle to a certain threshold, electrical stimulation is provided. Again, it's more volitional based. The patient is driving the device as opposed to more of a passive device where you just put a stimulation on the patient and the patient doesn't do any active movement and it's more passive. So this here diagram just describes the method. So you put the electrodes on the muscle, the therapist sets the threshold that the patient needs to activate, the patient activates the muscle to that threshold, and stimulation is triggered. What's unique about the Trac Infiniti as well, it also features reciprocal EMG trigger stimulation. And this is really ideal for those patients who are working on that balance between the flexors and the extensors. And with this, you have electrodes on the flexors, you have electrodes on the extensors. The patient would activate the flexors to a certain threshold. Then they relax the flexors to the point where the therapist would set. And then once they relax their flexors, stimulation is provided to the extensors. So again, the patient activates the flexors, Then they relax the flexors to a certain threshold that the therapist would set. Then stimulation is provided to the extensors. This is really appropriate and really ideal for those patients who are working on that balance between the flexors and extensor muscles. By teaching the patient on shutting off the flexors, it then provides that stimulation to help the patient understand, okay, I need to shut off the flexors to this point to get stim to the extensors. So there's not a lot of devices on the market actually that has that feature. And you could also use that same protocol for the lower extremity as well. So put electrodes on the plantar flexors and dorsiflexors. The patient would need to shut off the plantar flexors to a certain threshold to allow stimulation to be provided to the dorsiflexors. One of Saebo's newer devices is called the Saebo VR. So this is a virtual reality system that Saebo offers that's designed for designed for individuals to engage the patient in more ADL-based activities using the upper extremity while engaged in a VR environment. The patient would have a virtual assistant or avatar called Claire that would guide the patient and through various protocols and would be able to provide a patient with real-time feedback as well. It really helps patients to incorporate their upper extremity in real-life activities. I like the Saebo VR because, yes, of course, we can engage in real-life activities, but what the research shows is when we offer unique and innovative techniques for our approaches to patients, it helps facilitate cortical plasticity. So here, using VR or virtual environment, you can engage the patient in something unique and different while also following it up with real functional, real-life activities, because I think it's something different that helps stimulate that cortical plasticity, which is so needed. So some of the virtual ADL tasks, as you can see here, there's a list. So grocery shopping, putting away groceries, what have you. And why do we need to use it? I think the slide is emphasizes the point enough, and we brought it up earlier, that individuals aren't including or engaging their upper extremity as often as they should be after a neurological injury. So this is just another way of stimulating the upper extremity. And this slide is research that shows the effectiveness of the Saebo VR. Okay, and these are just some other benefits of the Saebo VR. We highlight function, so the functional aspect. Function is important. I like it too because you might be in a clinic where you might not have an opportunity to do gardening. So like in the photo here. So here it gives you an opportunity to engage in tasks that might be interesting to the patient or engaging for the patient, if specifically if you don't have an opportunity to go to a grocery store or to do gardening of some sort. So just opens up a lot more possibilities. So who are candidates? Patients with who's a candidate? Patients with cognitive or upper limb impairment. That could be neurological or orthopedic. To address the physical limitations with the Saebo VR, you can incorporate other modalities like the SaeboMAS, or maybe electrical stimulation options like the Trac Infiniti or the Viva Stim, or potentially use the SaeboGlove as well. And here are some pictures of some of the other devices in use with the Saebo VR. And lastly, we have the SaeboReJoyce, which is an upper extremity workstation for the orthopedic and neurological population. So basically, it's a workstation that the patient would engage in different tasks, challenging gross motor movement as well as grip patterns, and it's all correlated or related to as the patient is engaging in different games that are displayed on the computer screen. The workstation consists of a tabletop mount. This is a spring-loaded system, as you can see here. And you have a handle, so the patient would use the gripper to grab different objects, or you can work on different grasp patterns as well. And that's all at the same time while the patient is engaged in various games are displayed on the computer monitor. Why use SaeboReJoyce? Again, I think it goes back to trying to encourage task-oriented treatment, and as well as offering something innovative, different to keep the patient's interest and to help with the cortical plasticity. Here are some of the grip patterns that are available that the patient can work on. And this is a slide that just shows some of the gross motor movements that the patient would engage in. So at this time, the patient is engaging in a game, okay? So you can really highlight and emphasize individual movements while they're using or playing the different games displayed on the computer screen. Some of the games really work on speed, endurance, coordination, range of motion. Here are some sample games that the patient would engage in. Okay. Also, it has a functional arm test as well, so it can assess the patient's motor ability if need be, and can track the patient's progress. So if you need an outcome measure, it can give you an outcome score of how the patient is progressing throughout their treatment. And each patient gets a profile of how they're progressing with the program. So the components, it comes with a computer, the manipulandum, which is a hand piece, the arm piece that attaches to the table, as well as an instruction manual, as well as a quick reference guide. So as a follow-up to the webinar, as I mentioned earlier, a representative from Saebo will be calling you just to see how the webinar went and if you have any questions. But also, Saebo offers for the facility-based products, they offer a 10-day trial, where it's just your opportunity to explore and play with, get some hands-on experience with the Saebo products. So that includes the Saebo VR, the SaeboMAS, the SaeboMAS Trac Infiniti, and the SaeboReJoyce. So that's a 10-day free demo, in-clinic demo that Saebo offers, so please ask about that. And then for the patient-based products, Saebo offers a free 30-day free shipping, free returns trial. So a 30-day risk-free trial, and that's of the SaeboFlex, the SaeboStretch, the SaeboStep, the VivaStim, the SaeboStim Micro, and the SaeboGlove. So again, offers a really good way to have your patient trial out some of the products that we discussed today in the webinar.